So we're talking about corporate dentistry, and the one thing that I've always wondered was, how can a corporation own a private practice? What's the legality of that?
Yeah, well, it's a very fine line that's been drawn, and it's evolved over time, over the past 20 or 30 years actually. The laws of most states prohibit anyone other than a licensed dentist from owning a dental office, period. So, over time, as this oversupply of dentists has become common, and as dental individual debt for dentists as they graduate from dental school has become so high, corporations have moved into this segment of healthcare by working with a dentist license. In other words, there'll be a dentist that develops a large practice. He sells a management, or the corporation creates a management agreement with this dentist so that he technically owns the practice on paper, but the corporation is his management firm. And that's how the running of the practice has been shifted to corporations. Now, as the practices grow and they get more and more locations, obviously this original doctor no longer has a part in running or even treating the patients. So there are dentists hired in these various offices that are employees of the management firm, but the dentist still owns on paper the practice. It's a really insidious problem, and it's been very difficult for the state law enforcement agencies to prevent these things from happening. And in fact, they've basically now given up. That's why if you go to most shopping centers in nice suburban areas, right now you'll see dental offices in virtually every shopping center. Those dentists that work in those offices come and go as their financial needs change. The scenario basically is a new dentist gets out of school with a couple $100,000 worth of debt for their dental education. They need immediate income, and the corporations are able to give them immediate guaranteed salaries. In exchange for that, the dentist is under immediate pressure to produce a lot of dental treatment, and this is where the problem in the patient relationship really breaks down.
And I would add to that dental school debt usually is far exceeds a couple $100,000 now. Private dental school tuition is almost at $100,000 per year. So you can imagine the pressure on that individual who graduates with $500,000 of debt, needing to service that debt, but starting your own practice takes 3 to 5 years to actually hit your stride. So the supply and the demand for the corporate model is it's excellent right now, because the students getting out with all this debt desperately need to be able to service the debt, and that's how the system really works beautifully for the corporation and not for the patient.